People can be stuck in chronic therapy. You can be stuck in patterns because there is some sort of discomfort that comes with true healing.
Yeah. And it's not easy. It's not easy. By the time, doc, you explain to a patient that they need to be in therapy for at least 8 to 10 sessions.
Yes.
Some of them will ask you 10. I need to speak to you for 10 sessions, 1 hour plus 10 times, And then it becomes very difficult for them to even embrace that they need to put in that much effort.
Yes.
What even becomes harder for them to configure is the fact that they cannot be in therapy for all their lives.
No. You cannot be walking in clutches forever.
Exactly. Hata ikikuja ni kwa dawa, haizi kuwa ati yako hapo the entire time. Because I think something they don't understand, and I would like you to tell them as a psychiatrist, is medication has insight into it, right?
Yes.
So there are days when utaongeza dawa, na kuna siku utapunguza dawa.
Yes.
So ideally, if you're dealing with a person who wants change, will you be on the same regimen from start to end?
No. You cannot.
How long?
Because
let's answer their question.
the dosage that we started with from the beginning, most of the time, sometimes we start with probably, depending, we graduate as we continue, maybe maintain you on something. But can you imagine, there's a time that will come that I will have to reduce that dosage. And the moment I start reducing it and I notice that still we are not improving, then I start questioning myself. There's a problem.
There's an issue.
Because ideally, if I've treated you for 9 to 12 months for an anxiety issue, then that one should be enough, depending with the circumstances, of course, because all patients are different, of course.
True.
Treatment has to be individualized. We also have to take into account other comorbidities or whatever. So sometimes it must not be cast on stone, that it's 9 months, 6 months, 12 months. And that is why I usually tell people that healing takes time. And even if there's somebody who can take 2 years on for a similar condition, another one might take lesser, but it doesn't mean that you have a problem per se. It's because of maybe the situations, experiences that you've had as a person. Yeah.